Welcome to page 53 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The muscles of the musculotendinous cuff. These are also known as the rotator cuff muscles, aka the sits muscle. Supraspinatus, Infraspinatus, Teres Minor, and Subscapularis. So an anterior view, or a view from the front, shows first, well, actually, let's start with the S of the sits muscles. Let's start with the supraspinatus. And we'll look at that from the posterior view. This is from the back. Of course, you know, the spine of the scapula here, and the acromion process here. The supraspinatus muscle, as talked about in previous discussion, lies in the supraspinous fossa. It's this fossa, or this hole, that's above the spine of the scapula. Hence the supraspinatus muscle. And here you can see the supraspinatus coming under the acromion process of the scapula and inserting on the greater tubercle of the humerus. This is why we learn about all these little bumps on the bones, because they wind up being important or origin and insertion points for muscles and ligaments and tendons. And here from the front view, you see the supraspinatus, and you get a peek of it here running on the other side. It's on the other side of the, it's on the posterior side of the scapula in the supraspinous fossa. Here it is inserting on the greater tubercle of the humerus. Next, the infraspinatus muscle. Well, guess where the infraspinatus muscle lies? In the infraspinous fossa. Infra means below. So it is below the spine of the scapula. And here you can see it running, taking up the whole of the infraspinous fossa and attaching again on the greater tubercle of the humerus. And from the course that it's running, you can tell what action these muscles are going to have. It's reaching, it's in the back, this is the posterior view, and it's reaching along the lateral side of the greater tubercle there. So it's obvious to me that the infraspinatus muscle would pull this humerus around in a lateral direction, in an outward direction called lateral rotation. Teres Minor is in a similar way from the lateral border, originating here in the lateral border of the scapula, to also insert on the lower portion of the greater tubercle there of the humerus to do what? Exactly what? Of course, very much the same motion as the infraspinatus. Lateral rotation of the humerus, turning it outward. Incidentally, the supraspinatus, you can see from its course of action, or from its origination to its insertion, how it would be an excellent, since it's up top here above the humerus, looking here at this top diagram, inserting on the greater tubercle, it's naturally positioned to abduct or bring this arm up away from the body. Abduction, here it is right here. when the supraspinatus pulls this way, the humerus, it pulls on the tendon right here, and the humerus is naturally leveraged up because of the shape of the concave shape of the humeral head. The humerus will wind up going out into abduction. Lastly, the final sits muscle or rotator cuff muscle is called the Subscapularis. And of course, the Subscapularis lies in the subscapular fossa, underneath the scapula. Sub means underneath, like a submarine goes underneath the water. The subscapularis muscle is underneath on the underside of the scapula. And here you can see the subscapularis muscle inserting on the lesser tubercle of the humerus. And you can see the lesser tubercle is on the anterior side. We're looking at the anterior view now from the front. And so you can see it's got great leverage to pull the humeral head inward in this direction. And what motion will that create? That will create internal or medial rotation. This motion here, turning the arm, the humerus inward. And below we can see the origin and insertion points. The origin of the supraspinatus lies in the supraspinatus fossa and then inserts here on the greater tubercle of the humerus. You can see the origin of the infraspinatus muscle, meaning below the spine of the scapula, and its insertion here on the next to the greater tubercle, and the Teres major muscle, or excuse me, the Teres minor muscle on the lateral border here of the scapula to the lower part of the humeral, or the posterior part of the humeral head. There are some places that in the shoulder, because of its great mobility, they're subject to injury or degeneration from overuse, so trauma or degeneration over time. It's a very precarious place because of that mobility and so much going on in there. For example, the coracoacromial ligament. Here's the coracoid process, and here's the acromion process. A vulnerable place for tear during, say, shoulder separation, for example. The degeneration of the acromion process itself. The AC joint, the acromioclavicular joint here, often becomes separated. And if it becomes slightly separated, it will rise up if this ligament tears, and there will be a bump called a step deformity. And perhaps you have separated your shoulder and you have that bump palpable. Another area, the supraspinatus tendon, as it passes underneath here, the subacromial space, and the shoulder lifts up. It is an area where this becomes, and it inserts all the way out here, as you can see right here in this upper drawing here. It winds up gliding upward and then being pinched underneath the acromion process. Another spot that can be injured is the subacromial bursa itself can become inflamed get shoulder bursitis. So the shoulder, while providing great mobility and movement for the arm, is also susceptible to injury. And lastly, we can see the subscapularis origin here, by the way, and how it inserts on the lesser tubercle of the humerus on the anterior. And this represents the end of the page 53 of Anatomy Coloring Book, Muscles of the Musculotendinous Cuff. The sits muscles, the rotator cuff. This is Dr. Stephen Harkins.